You're listening in here on this Thursday morning, Aloha Morning Show with me, the Hawaiian Homeboy. And every Thursday right around this time, we welcome in one of our health professionals from Maui Health. And we want to say good morning to internal medicine physician from Pacific Permanente Group at Kula Hospital. Aloha kakahiaka to Dr. Lisa Sodetani. Good morning, doctor.
Hi, good morning, Shane. How are you?
Good, Lisa. Thank you for joining us. We got a couple of questions. A great subject because in my family, I've had family who have passed away who have had major problems with their kidneys. So, how can I keep my kidneys happy and healthy, Lisa?
So, three main things.
Okay.
Number one, stay hydrated. It's been getting real hot, so everybody got to make sure they drink plenty of water and keep hydrated. Number two, really watch your sodium intake. And I know all of our foods we love to eat. Plenty of sodium if you look in the back of the labels.
Me too.
Really got to watch. And then number three, if you're diabetic or at risk for developing diabetes, like you have that in your family, really watching your sugars. Most importantly, it's to watch your blood pressure.
Yeah.
That seems to be the real silent thing that can kind of creep up on us, and find that in the long term, if it's not controlled, it can lead to irreversible kidney damage. So avoiding smoking, exercising, and checking up with your doctor on a regular basis, especially if you have those risk factors like diabetes or high blood pressure. Or if you're having to take a lot of anti-inflammatory medications like ibuprofen, Aleve, naproxen, those can, unchecked, cause damage to the kidneys. So got to watch,
Doctor, how can someone lower their blood pressure in the case that their pressure is high?
Like I was saying before, really watching their sodium. So a lot of the stuff we eat are loaded with sodium. The recommended daily serving is less than 2,300 milligrams a day. But if you look at the back of like a package of Simon, it has 1,800 milligrams of sodium.
Oh, wow.
So that's over 3/4 of what we should be having in one day.
Wow.
So really starting to watch the packaging. But there's a lot of good substitutes out there that you don't have to always rely on. That's still pretty reasonable. For example, I like to eat shirataki noodles. They have that at the local markets, and I use that instead for things like Simon, chicken long rice, other good stuff that we like to use, but really limited on the sodium and really limited on the sugars in there. So good substitutes out there, just gotta look.
Yeah. Doctor, when it comes to asthma, I remember when I was younger, it really wasn't a concern. I mean, I knew people who had asthma, but it is a serious situation. What are the best treatments for asthma?
So typically there's two types that most people will use. A long-term control medication and a quick relief, or what a lot of doctors will call rescue medications. There are also certain pills or injections that can also be used, but that's usually for the more severe cases. The long-term medications, the long-term inhalers, are things that we use every day, and they really help to reduce the inflammation in the lungs. So if you are in a place where there's a trigger, say smoke, dust, things like that, that can really trigger your asthma, that's when you got to use the rescue inhaler. We tend not to like to use that rescue inhaler too often because it does tell us that, hey, if you got to use it more than once or twice a day, things in your lungs are pretty inflamed, and you got to go make sure that you're on that long-term inhaler.
Got it. So make sure you have your inhaler with you. And like you said, got to really pay attention. Like you said, pay attention to our blood pressure, to our sodium intake. Just got to pay attention.
Yeah, this month is Asthma Month.
Yeah.
So, kind of watch. Now the inhalers have these little numbers on it. So you know how many pumps and how many puffs you're using. So if you know that, gosh, I'm going through this, like the rescue one within a month. That's too fast. So got to make sure you check in with your doctor, especially now there's plenty pollen, dust, allergies going around. So always good to check.
Yes, indeed. Well, Dr. Lisa, thank you so much for your time this morning and answering our questions. Have a wonderful day. We'll talk again, okay?
Thank you so much. Take care.
Aloha.
Bye-bye.